Hello, Dr. P in biomechanics class. Today I have a video on hip movements and knee structure. Okay, first we'll cover hip movements, and then I will, I don't know if you can see, but I cut my knee drawn all over for my knee structure portion of the video. But first we will get into the hip movement portion of this video. Starting off, we will talk about flexion and extension in the hip. Hip flexion, okay, is when you lift the knee in a 90-degree angle, as so. Just light away, 90-degree angle, as so. And then extension is simply when you push the knee, you pull with your hips and activate. You drive the leg backward, and the activation of the hip muscle. More specifically, hip flexion is activated with the psoas major and iliacus. Make sure I pronounce that correctly. Yes, the iliacus. And most of the time, when people claim to have a hip pointer or hip injury, that's not super detrimental. It comes within the psoas major and iliacus muscle, which is in this vicinity right here. That light. I'm not 100% scoping accurate anatomically, but this is the general area for those two muscles that help activate when we do a hip flexion. Hip extension, okay, comes from the activation of the gluteus maximus, the butt. This is good for reverse lunge movements, coming back down on a split squat, a Bulgarian split squat, elevated rear foot split squat. You're going to activate gluteus maximus, even though the quad muscle could be the more dominant activation muscle in those exercises I just named. But the gluteus maximus will always be activating majority when we do a hip extension. Now, two exercises commonly used for the hip flexion, hip extension is one, like I just said, a reverse lunge, okay, which can be done as such, and a reverse lunge, and that is that movement right there. Okay, I'm pulling the hip, okay, activating my butt here. Okay, and this is an extension. Okay, my hip is activating. I'm squeezing my butt, and my leg goes back like that. But I'm activating and I'm extending the hip. To flex the hip, I would lift and drive in that 90-degree angle. And so, prevalent within box step-ups, box lunges, for those two movements. The other two movements that we have today are the abduction and adduction. Now, hip adduction and hip abduction, okay? Those two movements are labeled pretty easily when you go to the gym with hip adduction and abduction machine. When you sit down and push your hips either out or in, okay? Well, hip adduction, when you push your hips out, and abduction, you push them in. What I have are some exercises that I like to do. So, when you do a hip adduction, okay, back up. When you do a hip abduction, okay, pushing the hip out, common exercise to get in that 90-degree angle and activate hips, it's what we call fire hydrants, which is good for sprints, hang cleans, power cleans, squats. Good warm up those hips firing, get them activated, get them working, get them warmed up. So this would be an ABD, abduction. Okay, I'm pushing my hip away right there as such, and I'm in the 90-degree angle. This would be a hip abduction. Okay, and then of course the movement back down would be the adduction as I'm bringing it closer towards my body. Another good one to do is to abduct, but then flex, hold, and pull slightly down. You, of course, we're leaving that 90-degree angle, all right? And a lot of times, a good one for this hip adduction. This exercise simply slightly above 90 degrees, but this one's perfect for me because I'm a big guy. This would be a hip adduction. As you see, I place my hip on top of this bench, and what I'm going to do is I'm going to try to crush the bench into the ground, pull my hip down, and try to pull the bench down into the ground, which is an adduction because I'm trying to pull my hip towards my body. I'm in this 90-degree angle. Obviously, I'm not going to move the bench, but I'm going to squeeze. It doesn't look like I'm doing much, but this is a great warm-up. It's a great hip activator, and then of course you can hold it for longer periods of time to get a good hip workout in. You don't have the adduction machine, which is used. I like to use that It's a good squat warm up. Days when I have to do hang clean, power cleans, and my hips are feeling a little stiff, a little tight. It's a good way to activate and warm those hips up as well, so they're stronger. And some byproducts would be getting the butt, working the butt a little bit, because you know, even if it's hip muscle and stuff like that, you know, eventually you start to squeeze that butt as your hips get tired in regards like that. But that is our hip. Excuse me. And then we have, then we have external rotation and internal rotation of the hip. Now, internal rotation, okay, again, this knee is lifted. The lighting is bad today, sorry, Dr. P, but internal rotation, when I would lift my knee, okay, I would pull with the hip, and I would pull my foot inward. Okay, now to demonstrate this, because that was a horrible standing demonstration, I'm gonna do what's called a figure 4 or pigeon pose. So to internally rotate this hip, okay, I'm gonna pull my foot inward, rotating my hip inward, which is internal rotation. And for this exercise, pigeon in yoga, we called this figure 4 in high school. It was a good hip warm up, and then we did it to get some more depth and more stretching into the hip post-workout when your hips are fresh and warm and you can get a little bit deeper stretch. We did this called figure 4, and this is a hip internal rotation. Now, the external rotation, okay, which is not as common as the internal rotation. You know, your hips tend to give a little bit more in the internal rotation than do the external rotation. But with the external rotation, what I like to do, and this is a good, once again, hip warm up that I do before major power lifts. I need my hip drive and hip strength and flexibility. This one is a little bit more, I don't have a name for it, okay? But what you're gonna do is you're gonna start as so. Let me try to get this line. You're gonna start as so, okay? I start in the hip internal rotation position, but then I pull it, and then when I drive out, this hip, okay, obviously goes out. Now, is if you see, this hip is in, okay? I'm changing into an internal rotation, all right, as so, okay, because I'm pulling the hip inside. But at the same time, I can change it up. I can go back internal with that outside leg. It's hard to, I'm doing a pitiful job of explaining this, but as you see, we start with the hip externally rotated. And then when you change legs, this leg will now go to internally rotated, but then this leg becomes the externally rotated hip. Now, the easier way to demonstrate, okay, I have my leg up here, and I pull it this way, this is the internal rotation, and when I go the other way, it's externally rotated. Obviously, when you have that hip and that leg in a 90-degree angle, and you pull the foot inwards, it's an internal rotation. When you push the foot outwards, it's an external rotation. And that is my hip demonstration, hip movement portion of the video.
Hello, Dr. P. Odd choice that I have for this video. It's the best lighting in my house, where I could also film this and get some privacy. Yes, there's my foot in the sink. I am in my bathroom, and yes, these are some nice new tattoos. My camera's shaky, I apologize. Phone's getting old there in age, but I will describe this, explain this perfectly as best I can. What I have drawn up is the labels for the knee structure, but we'll get into that. It's not just one big blob, and I'm gonna describe, because the sweat from performing the hip movement portion of the video has rubbed away my new tattoos. So, getting into the tibiofemoral joint, okay, the knee structure, diving right in. Okay, so the tibiofemoral joint, it's the dual condyloid articulations between medial and lateral, medial and lateral condyles of the tibia and femur. Okay, so pretty much, here's our tibia bone, and here's the femur bone. The dual condyloids on the side here, and this makes up, okay, the patellofemoral joint. Okay, the patella, big circle guy right here. Now, here's the patellar ligament right there, and the big circle guy is the patellofemoral joint, and here are the medial and lateral, medial facets, okay, on the sides here that make up and help make up the tibiofemoral joint. Again, it's dual condyloids on each side, and this is the main hinge joint of the knee. Now, with that also being said, the patellofemoral joint It also aids in load improvement, okay? The extension level up to 50%, and just loads in general, okay? Like I said, the patellar ligament, that main one here, and then the kneecap, technically, for simpler terms, is the patellofemoral joint here in the middle, made up of these two facets. Now, moving right along, the meniscus. I know a little bit about this. I tore my meniscus. It was God, I cannot remember that. I think it was a butterfly tear. That doesn't sound correct, but it was a slight tear where it folded over, and they had to cut a chunk out. Anyway, the menisci, okay, obviously it makes a circle in the ligaments around the said kneecap here. Okay, and the menisci aids in shock absorption and load management within the knee. And then if, like, when this ligament is torn or slightly torn even, it can disrupt or hinder load absorption and even lead to other knee ligament injuries. Tore mine right along here, and it kind of capped over, and they had to cut a chunk off here. And I know where a part of my meniscus is, because I could feel it right in this area, right, for a good long time during my junior college football season. Anyway, and this guy will circle around, okay, and it will connect and kind of tie towards the middle here, which we will dive into a little bit later with knee ligament structure and how they connect. But this is the menisci that we're referring to. Now, what we're about to get into here is the collateral ligaments and the crucial ligaments. I'm probably butchering that word. But the collateral ligaments, okay, are laterally, mediolateral, but they're on the side. Now, this is obviously an anterior view of my knee that I've been given. But the collateral ligaments, okay, are located here on the side. What they do is they simply cross the medial and lateral aspects of the knee and connect the ligaments together medially and laterally. And they will be located here on the side. As so, here's a good one that we're looking at right here. But that's the collateral ligaments. They located on the side here. Crucial ligaments. They connect anterior and posterior, under me, behind me, aspects of the knee. For that, I have my other tattooed leg. Okay, this is obviously an anterior cruciate. It's kind of crucial. That's what this note's here for. Cruciate ligaments. Now, this is the anterior cruciate ligament, and they cross together. Obviously, this is a superficial, anterior view here, but they cross the ligaments together from front and the back, and they pull them and keep them together, and they are connected a little bit deeper in the knee, and even some ligaments on top, but they connect the anterior and posterior aspects of the knee together, and these are what they call cruciate ligaments. And that is the knee structure overview. Thank you.